Hello, good afternoon and welcome back to Dr. OPD. Sorry it's been quite a long time since my last video. I hope you don't mind the wait. It's been a busy year. I wanted to speak to you about Parkinson's disease and sleep problems because I've been developing sleeping problems over the last number of months, and I think it'd be helpful to highlight what the problems are and some solutions that might be able to help for people who have PD who may have sleeping problems. I think it'd be fair to say that most people with Parkinson's disease have sleep problems of one sort or another. For me, my problems date back to when I was first diagnosed 3 years ago, when I had really severe foot pain, and just having the really severe foot pain was enough for me not to sleep properly for days and days on end. That only really got better after I started treatment following the consultant seeing me in December. More recently, over the past few months or so, possibly even up to the last 6 months, I've been finding it easy to get to sleep, no problems getting to sleep at all. It's been difficult to stay asleep. So I would be going to bed maybe 9:15 in the evening, and I'll be waking up 11, 12, 1, 2, 3, every hour up until I get up about 6 o'clock in the morning. It's been difficult to stay asleep, which is quite common. I've had difficulty straightening my leg at night because of cramping pains in my right leg. Particularly just straightening my right knee joint has been very difficult. My flexibility in my right ankle has been very difficult. And I've also had difficulty turning over in bed at night. It has been tricky. So things I've tried, as you may well have guessed, I tried exercise. That didn't really make a big difference. Stretching does help a lot actually, particularly doing gluteal stretches, calf stretches, anything that has to do with stretching my legs has helped. I gave up caffeine in the vain hope that might make a big difference, and it didn't really. And then the best thing I did was after my wife pointed out that I should do, I phoned my PD nurse, and she was really very helpful. And we went through the possible options that there were available, and she felt that the best opinion was to start on a slow-release L-Dopa tablet. The option I've been given was half Cinemet CR. And I was to take it at 9 o'clock in the evening, and that was to give me slow release of L-Dopa overnight to help. And it has made a massive difference. Really very helpful. I can now straighten my leg. I can roll over a little bit better. It's not solved the problem entirely. I still have time where I wake up at night. I am able to get back to sleep again much better. So that's why I wanted to speak about sleep. I thought it'd be helpful to highlight the various different sleep disorders that do come with Parkinson's disease. What I've described is sleep maintenance, insomnia, where you can get to sleep quite quickly, but staying asleep is a lot more difficult. Then there's REM sleep disorders, which affect up to half of people with Parkinson's disease, and I may develop this later on in my disease process. REM sleep, otherwise known as rapid eye movement sleep, is a dream state. And one of the problems with REM sleep disorders is rather than having the body being paralyzed, the body is not paralyzed, and it actually acts out the REM sleep dreams, and therefore you have a significant problem with aggression and kicking out. It affects up to half of people with Parkinson's disease, maybe more, maybe less, but it is a significant problem. So REM sleep disorders can affect people with Parkinson's disease, and it can actually precede the diagnosis of Parkinson's disease by 5 to 10 years in some cases. Things that can help with REM sleep disorders, occasionally medications can help, but often it's just managing the disease process itself, so sometimes sleeping separately, sleeping with padding. The medications such as clonazepam can help, or melatonin can help. Other disease processes that can occur with Parkinson's disease is Restless Leg Syndrome, which can respond quite well to dopamine agonists such as pramipexole, ropinirole. Those kind of medications can help with that. Another common problem is daytime somnolence, which is worse as Parkinson's advances. I suspect that's probably because people with Parkinson's disease with sleeping problems won't sleep effectively overnight and therefore will be tired during the day. However, there's also the problem that people with dopamine agonists, such as pramipexole, ropinirole, or rotigotine, can have sleep attacks where they actually fall asleep whilst driving or fall asleep during the day. That can, of course, affect your ability to drive, and the DVLA will be notified by that. If you're on a dopamine agonist, it can lead to restrictions to your driving. Other problems that can affect people with Parkinson's can affect other people as well, such as sleep apnea and other problems as well. But I wanted to highlight that sleeping problems is common in Parkinson's disease and has affected me, and it is probably a sign that my Parkinson's disease has advanced a little bit over the last year. It's hard to know whether that's my disease process on its own or whether the lockdown has affected me by me not being able to get to the gym and exercise as much as normal. Well, I hope this video has been interesting for people, and I will be, of course, linking to the Parkinsons UK website where they discuss sleeping problems, and I hope you all have a wonderful day. Bye for now.